Hello everybody, my name is Torstен Fishер. I'm FDM instructor from Hanover, Germany.
Deal with misconceptions about FDM.
Yeah.
Is it just a collection of techniques?
Of course. No, of course it's... Actually, I can tell you from myself. I did an experiment the last years. I gave a lot of advanced courses. And in those advanced courses, a lot of my students, I think they expected the 7 distortions or some special manual techniques. And I showed them a lot of techniques. And I saw when I only teach techniques, if you do not understand by cognition the FDM, it will never work. The technique will not work. So it's very, very important for the FDM to understand the background, the philosophical background and the basis of the body language, of the picture of humans itself. If you don't understand this, it will be very, very hard to do the techniques correct. So the techniques are based on the philosophy of FDM. And this is already a problem what we have here in Germany, because FDM is widely spread now here, and we have a lot of people who come to the seminars who don't understand the philosophical background but still want to do it, and they mix it in their clinic with other techniques, and that's very, very difficult.
Yeah, I think. Is it appropriate only for the treatment of so-called myofascial pain? And if not, what does fascia mean from the viewpoint of FDM?
Oh, it's a good question. If we explain everything with fascial distortions, so everything where's fascia can be a distortion. And if we say bone is calcificated fascia, then we can treat also bone. But I think the only question for us is, I think everything consists of tissue, yes? Sometimes the tissue is calcificated, sometimes not. And I think that the only problem for us, as I come from manual medicine, I treat everything with my hands, and sometimes I use some tools like cupping tools or some gloves or combs or something like this. But actually, sometimes patients have pain which is very deep inside the body. For example, disc hernia. I have some patients I cannot treat by hands or by traction or something like this. Then sometimes some patients have a tumor, and the tumor causes some pain too. Then we need a surgical FDM technique too. But I think it's still FDM.
How is it integrated in medicine? Is there any scientific proof which supports its use? And please tell us about the future projects.
First, if you ask for the scientific proof, we have to ask for what kind of scientific proof, yes? I mostly ask from physiotherapists and doctors too, who will not come to the courses if there's no scientific proof. So I think there's one kind of scientific proof, that those people who are fixed on a scientific proof, who want to respect the FDM. And this is mostly clinical studies, yeah, what these people look up to. And we have some clinical studies so far. You did a shoulder study in Iran. We have here a dissertation from a doctor from Hanover. He did a shoulder study compared to conservative manual therapy. We have a Polish study, fractures in the forearm. We have now a study from a colleague from Germany here in, I think in anterior crucial ligament tear. And we have some clinical studies already, but we don't have so many studies concerning the model itself. Like, for example, do we have some ultrasound pictures of facial distortions or something like this?
Yeah.
We have one study for the inter-rater reliability. So this study looked on, do we FDM therapists, do we all see the same? So maybe, you know, we see some body language and everybody sees a different body language. So when does the body language become an objective finding? And I think the percentage of the inter-rater reliability of facial distortion model is up to radiology, as about on X-ray level. Dr. Hara, he wanted to make a study with the University of Vienna in the field of anthropology, about the gestures in the humankind history, you know, about the pain gestures.
As the next question, please somewhat explain about the situation of FDM in the world in general and in Iran in particular.
Yes. Okay, it's difficult to say how it is in the world, as the world seems to change now in the moment. And we have to see how the world will be after, when all this is finished. And but I think if we look globally on medicine, we have objectification in medicine. We want to have, if we look on the manual therapy, like craniosacral therapy or trigger point therapy, chiropractic, myofascial release, we have an objectification. Always the orthopedist doctor, he looks on the MRI or on X-ray. The craniosacral therapist, he only listens to his hands. The trigger point therapist, he goes to palpation and looks in the book of Janet Travell. So everybody has an idea already what this patient has. And everybody has an idea that the pelvis is not correct, or that this trigger point needs to be treated, or the craniosacral rhythm is not good, or that the meniscus tear is responsible. And I think this changes now, that the doctor or the physician or the physical therapist doesn't need to be the expert anymore. We have a lot of information. We have the instinct of the patient. Centered care. And I think this is what we are doing in FDM.
What's your recommendation to all who see patients?
My recommendation is to be honest to yourself, to accept that there are always patients who challenge you, and that you should never stop learning. Never stop learning, and sometimes together with the patients. And to have some empathy for the patient too, because we can all be one-time patient too. You know, tomorrow we can have a back pain too or something, and we will be happy if somebody will be really kind and give everything for us.
Yeah, sure.
And also, you know, also for me, some manual techniques are difficult, and some I know I cannot maybe do so good as others. And to keep developing, to keep learning, to keep practicing always, and to never stop until the end of your life.
Stay tuned and watch our content.
What's your favorite movie and book?
Oh, my favorite movie. Oh, I cannot say. There are so many favorite movies. I like actually Scandinavian movies because they have a very black humor. And my favorite book is from Dostoevsky. It's called Schuld und Strafe. It's in German. It's what is the English title of this book? Oh, I don't know.
What's its subject?
Oh, it's this guy Raskolnikov. He kills an old lady, and he talks a lot about, it's the opinion of Dostoevsky, but in the middle he talks a lot about to be just middle in life always. What is it? I cannot remember the name in English. But Dostoevsky is one of my favorite authors, which I read a lot.
Yeah. And do you watch the cartoons?
Oh yes. I always advise this one movie. Yes, well, this one cartoon
Yes.
with Ab durch die Hecke. It's in German. What is the? I forgot the name. And now I watched with my children Madagascar. That was very funny too. 1, 2, 3.
Yes. Yes. Sometimes I see you take a picture from
Yes.
cartoons.
Yeah. Because now here in Germany, the children don't go to school, and so we have to do something. And so we go out every day, and in the night we watch a movie, and then they can sleep because they don't need to get up at some time anyway. There's no school yet. And now we have Easter vacation, and probably after Easter vacation, the schools will not open.